Hi everyone, Bruno from Brighton Implant Clinic. I'm going to be talking to you today about how we helped Graham restore his smile and replace what were some problem teeth. So just going to give you a little bit about the background and what we did and how we basically overcame some problems that he was experiencing when he came to see us. So this is Graham, basically a very nice gentleman, and he first presented at our clinic, saw one of my colleagues, and the main issue that brought him to see us was that he actually had some missing teeth on the right side. So as you can see over here, in this area over here, there are some missing teeth, and those teeth unfortunately were lost because of some secondary problems, secondary decay, and also over time some crowns and bridges that were unfortunately come to the end of their lifespan. Okay. Graham actually had no real toothache at the time, but obviously was feeling that these teeth were missing. As you can see from this image over here, you can see on the left side there are teeth that are basically, these are the most like important teeth for eating, chewing, you know, like heavy duty work, and you can see that on that side these teeth are basically missing. So it basically puts strain and stresses on the other teeth, and you're finding that it becomes quite difficult to eat. So the main issue was really to restore this area on the right side. We then noticed that there were some issues on the upper right canine over here, and this tooth over here. This was the upper left canine as well, and the upper left premolar and upper left molar. What we find on those teeth is that these signs or these problems are clear on a 3D CT scan, and even though patients sometimes might not have any symptoms, these are like low-grade problems that sometimes you might be run down, you might be slightly unwell, and you might get toothache, and this toothache comes from these low-grade chronic infections that basically gather a little bit of pace and start to cause you some discomfort. And that's what we found. Once we had done a full analysis, we explained to Graham that it was probably best over the long term to consider a more comprehensive treatment approach, which would actually take care of all of these problems with one more complete solution. So the good thing about a solution like that would also mean that over time, these crowns and bridges that had been restored at different stages of treatment, basically we could look at providing one more complete solution that would address also the fact that these teeth are actually pointing downwards, you know. So by having different stages of treatment and over time the stresses that have been placed on these crowns and bridges, very often our teeth might splay to one side or they might tilt, and that was something that was very important on the priority list to try and fix. So as you can see over here, this were bridges done at a different stage. This was one stage, this was done at a different time, and this here was again done at different times. Different shades, different designs of teeth, unlike what had been planned, which was going to be one like complete solution for all the teeth together. With bridges, the problem that we sometimes have is that you might have a bridge that's functioning well, but one of the supporting teeth might have a root treatment that has failed, and when that happens, you unfortunately land up losing the whole bridge, which is kind of the situation that we're in. So the plan was to do a all on X solution. As you can see over here, there were 6 implants, you know, this one placed in the extremities at the very back of the mouth. These are known as pterygoid implants, and then just a conventional all-on 4. This is 4 implants, and this implant was actually replaced because it was not in the most favorable position, but a position that would actually be a better implant for the patient's long term. Obviously, after a thorough and detailed analysis, we gave the patient a report, discussed all the advantages and disadvantages of having this treatment, and we then, once the patient had agreed, we decided to go ahead and with the help of an anesthetist, we basically removed these problem teeth We cleaned all the infections that were evident on the CT scan, and the implants were placed during one session. Normally this will take about 2 to 3 hours, and straight after the surgery is done, we basically capture intraoral scans, and digital photogrammetry positions of the implants and teeth are actually made that will fit onto the implants the same day or the day after the surgery. So here we can see the arrangement of the implants. You can see there are 6 implants. What we're looking for over here is that these ones here at the back, so those are at the very back of the mouth. These are known as pterygoid implants. Pterygoid implants, they serve a very good and important function. They basically prevent levering forces on these implants at the back. So with a conventional all-on-4, we're only placing 4 implants here at the front, but in some cases these 4 implants are very close to each other because patients have very limited amounts of bone in their upper jaw. So by placing these pterygoid implants at the back, it means that we can provide patients with a much more secure, much more stable and complete solution, as you can see, and that will basically restore the whole upper arch. So much stronger. The other thing important to note over here is how healthy these implants have been over the healing period. And you can see we always look for these areas in front of the implants whereby the tissue is nice and healthy. You can see nice thick pink tissue is very important for long-term health of the implants. This was the x-ray that we've taken at the end of the treatment, and here we can see how there are 6 implants, these pterygoid implants here at the back again. This bridge that has been created in our dental lab, it's made out of 2 substances, one titanium, which acts as a frame, as a rigid support to actually support the zirconia shell, which you can see, so it's slightly different shade of white here, and you can see this is the titanium bar that sits inside. Very important is to see how precise all these attachments fit onto the implants. So you can see everything fits really well. It's very precise. And what we show patients and explain is this here is basically the bone level, and we want to make sure that this is to the necks of these implants. So you can see everything here looks really good. All the bone levels around the implants is very healthy. If you look at this model over here, you can see that basically this bridge, it's normally it's on 6 implants. Okay, I always explain to patients the bridge of an all-on-X solution, it's always a little bit thicker and a little bit bulkier than your natural teeth. And the reason for that is that we need strength, we need support for the materials to make sure that they're strong and robust enough. And here you can see you've basically got 6 positions, these little 6 holes that you can see on this model. These holes are covered with special dental resin that's tooth colored, and you wouldn't feel and be able to see those holes, but the dentist is able to see them. And if ever you needed to take this bridge off, it's just a case of like opening these holes and unscrewing this. So this is a screw retain bridge. It's kind of like the most commonly used technique that dentists use today to be able to retrieve a bridge if ever there's any problem. And here we can see the function of the pterygoid implants. The pterygoid implants are basically at the very back of the upper jaw, and where possible, when we can place pterygoid implants, they really serve a very important function, because if we don't have these pterygoid implants at the back, it means that these teeth here are essentially suspended and they're not supported by anything at the back. And the reason why they're not supported at the back is usually there isn't any bone in this region. But at the very back of the mouth, in the pterygoid area, you're able to place the pterygoid implant, and that would basically prevent any levering type movement or forces on those implants, and that basically gives you like a complete solution. So this is a close-up of what the zirconia bridge looks like. So you can see this bridge is also like termed a hybrid bridge, and that's because it not only provides the teeth that patients are missing, but also this area, the soft tissue and the bone that has unfortunately receded and resorbed over time. So basically we're also replacing this pink area, which is the artificial gum. And that basically is very important for patients' facial profile to make sure that they're actually resemble and are as close to their original teeth and facial profile as before. So both the teeth and the gum areas are made in ceramic. Ceramic is a great material for this particular application because it doesn't stain and it's very easy to keep clean. So it's very biocompatible with tissues, and it's basically patients like it very much. It's super comfortable. It can be a little bit hard in certain cases where patients have upper and lower implant zirconia bridges, but in a case like this, it is really very recommended. It works really, really well, and we've been using it for over 10 years now as our material of choice for full arch bridges. Here you can see the detail that we have on the inside. So what you see, this here is basically the titanium bar. This titanium bar over here is basically the part that actually provides the strength that will support the zirconia. And what's important is that this titanium bar is actually made out of a single piece of titanium. So with our in-house milling machines that mill titanium, we're able to basically mill this out of one piece. So there are no weak points of cement detaching or the bar basically failing if there's ever any problem. In the past, we've seen that sometimes these little sleeves are actually cemented into a bridge, and they're also known as T-bases, and that is kind of old school or previous technique which unfortunately used to lead to a lot of problems. Quite often those small sleeves or T-bases would de-cement. But with something like this, you're basically assured that it's going to be very robust and very, very strong. What's also important from this picture is you can see, for example, it's quite difficult to see over here, but this profile or this shape of the bridge, it needs to be very rounded and very smooth. There must be no steps between the ceramic or zirconia and the metal. It needs to be a very smooth surface so patients are able to clean easily and thoroughly between the bridge and the gum tissue. And usually we would recommend a water jet. That water jet is basically pointed underneath or above where the bridge finishes. And if it's a nice smooth surface, then the water can basically keep that area very clean and it's relatively easy to maintain. And here you can see the fitted bridge, and it's really great. You can see from this area, this is kind of like the area that we really stress, very important to keep this transition very well maintained, very clean. And we do that with the use of a manual or electric toothbrush, making sure that that transition is kept clean. And that's kind of the area where the water jet needs to be working. These teeth are designed using CAD software. And so you can see we can really achieve, amazing results because basically we can make teeth absolutely perfect. We spend a lot of time with taking photographs to make sure that teeth are basically nice and level. So this occlusal plane that you see over here, we make sure that that is parallel to the pupils of the eye. And also this midline, we need to make sure that this also, it's parallel to a midline that goes between the patient's eyes and through the middle of the nose. Here we can see the beginning at the bottom and the after at the top. We can see with the previous teeth, there is different heights of gum margins that you can see, and this sometimes can be anesthetic for patients, especially when they smile. The fact that some of these margins are displayed is also quite a common complaint that patients have when having metal fused to porcelain type bridge work. Whereas with the newer approach, you basically have this area is basically hidden, right, between under the upper lip, and so you don't normally see that transition. And if the surgery is carried out properly, then you would basically plan that transition line to be hidden underneath the upper lip so that it wouldn't be noticeable, and patients are then able to smile with confidence. You can see these margins over here are now kind of what you would expect in a youthful healthy smile. all those neck regions of the teeth are all kind of coincident and all the same as each other. So we've come to the final picture. I'm really happy that Graham was pleased with the results. And as I explained, I think the teeth complement him well. I think, knowing the detail that we've gone into to be able to deliver teeth like this, we obviously, try to fulfill the patient's expectations and also take some notes. During the treatment, patient has, several series of temporary bridges to make sure that we get to the result actually before the final teeth are made. And then once the temporary teeth are actually the right size, the right shape, only then do we move on to the final zirconia bridge. You can see over here, if you look between, like a line between the pupils, and you can see this line here, you see that it's nice and parallel. So my line is a bit struggling to be parallel, and you can see again that this midline is somewhere in the middle as well. So I think it's given us a great result. Right, so we've come to the end of the journey, and you can see here basically this is the before, this is the after, and I think I'm really happy that looking at how the outcome of the treatment, you can see we had like a an inclined curve here of the teeth sloping to one side. The teeth are now nice and level afterwards. This was a journey that it took almost 6 months to complete, and a lot of that time is basically taken up with making sure that we have adequate time between appointments with temporary teeth that are made, and sometimes those temporary teeth are becoming more and more refined, more and more closer to the patient's expectations. It's probably the most important point that I stress to patients is, the first phase of treatment, which is placing the implants. It's a technical part. It's a very important and critical stage of the treatment. But what I find with time and with my experience is that patients really value the fact that once the implants are in place, the teeth that they're going to get, what are they going to look like? There is a lot of expectation and anticipation. They want to have that smile that they've always kind of hoped for and wished for. And if we don't take enough time making sure that the temporary teeth are made exactly how patients want them to be, then it means that we can't deliver a successful treatment. So in Graham's case, I know that we had, I think 2 or 3 different sets of temporary teeth, and sometimes it might be 1 millimeter additional length or 1 millimeter less length, or maybe making the arch, the smile, slightly wider, different color, different shape, different design, making the necks of teeth slightly longer or shorter. All those variables are basically designed into the temporary teeth. And once we get to a point where the temporary teeth are actually perfect and the patient's had an opportunity to test them and ask friends or family even their opinion, and we can then see the confidence that comes with delivering a successful treatment. We spend a lot of time taking photographs before and after, and one thing I see more and more is when we start the journey, we ask patients, can you smile? Because we're going to start your treatment now. And usually patients smile kind of hesitantly. Their facial expression shows that they've over time become used to not smiling very much because they might be concerned or embarrassed about how their teeth look. And when you get to the end, even if you look at this picture, I think the expression in the eyes is people are proud. People are happy with the teeth that they've got. And this is not the first time that he's seen his teeth, because he's actually been testing these teeth and these teeth have been getting better. So he already has the confidence and he knows that these teeth are him. He's helped to design and craft and, make the teeth basically his. So always happy to see that, you really get to the end and you see that patients are so proud of, the teeth that are there. And sometimes you feel like, gosh, I'm blessed to come to work and to be able to do something like this and to help everyone. So yeah, really happy. A great team effort, nurses and technicians that helped to make this possible. But yeah, very happy.